The African American Health Equity Task Force was a group of really concerned citizens that came together, I think around 2014, to begin to start looking at what are the root causes for the tremendous race-based health disparities in Western New York. Prior to the establishment of the task force, there wasn't really any clear leadership or clear entity. Now, as we sit here today, we have established the Buffalo Center for Health Equity, we have established the UB Community Research Institute, and we now also have the Erie County Department of Health Equity.
The Buffalo Center for Health Equity is a project that we hope will change Buffalo.
Really teach people, to do health literacy education broadly, and to bring people into research and knowledge around what ails us, and then to provide people with methodologies for better understanding and improving their own health care.
The UB Community Health Equity Research Institute is a university-sanctioned institute whose goal is to work toward eliminating the health inequities in our community.
Leveraging our research for the greater good is a cornerstone of UB's mission. And in Buffalo, health disparities are among the most pressing problems facing our region.
The university has brilliant researchers, and we're going to need the best research and the best ideas in order to solve these problems that have been unsolvable for centuries.
The Erie County Office of Health Equity is a division of the Department of Health in Erie County. It was passed via legislation in 2021. So what this office is going to do is prioritize understanding the reasons why that is happening and helping us as a county address those issues so that we can have people who have longer, healthier lives.
Igniting Hope was started about 6 years ago. We're entering our 6th year of this conference. It's pretty exciting. And so it becomes really an exciting experience just to have this cross-section of individuals in one room at the Jacobs School of Medicine.
Igniting Hope is very important because it's a lot about truth-telling, but it's also about encouraging people to let them know that these things can be changed.
This is a terribly complex issue, one that is deeply embedded in our society. The more perspectives that we can bring to bear on this, the better.
Then COVID hit. And when COVID hit, this community was in a unique position because we had developed relationships with the county health department, with the university, with Kaleida, with ECMC, other partners who were dealing with public health at that time.
What we knew was we needed to educate people. And I surmised that the easiest way for us to do that was to call and do health literacy education on the phone. And then around March of 2021, vaccines were ready, and that's when we pivoted. We actually got over 100,000 people registered and to their appointments.
One of the things that was pretty evident following the initial COVID situation until now was that it was impacting people's mental health.
The Mellowing Minds Study is a community-based research project that truly places community partnerships at the forefront.
But most importantly, it's really helped them to use this resources they have within themselves and also be able to reach out and get assistance and help when they're struggling with mental health.
The food pantry is based over at Lincoln Memorial United Methodist Church. During COVID, we recognized there was a great deficit in the access to food. We started in September of 2020 with a pantry that served about 25 people, and now we serve probably more like 300 people. Every time an individual comes and picks up a bag of groceries, they get fresh produce in those bags.
I think the big wins and the big goals are to create change in underlying institutions. Do things that will change systems about how we operate.
Good health is a human right. Every human being has the right to live a healthy life.